I'm Dr. David Morton. I'm the Deputy Medical Director for Nkoma Hospital. The key priority is to provide an essential health package to the entire population, and that's a goal of the Ministry of Health. The challenges are they don't have the funding and we don't have enough personnel. In fact, over the last 4 years, the Ministry of Health has only provided 25% of funding for all of healthcare in Malawi. That means 75% is coming from somewhere else, mostly from outside, 12% from what people pay themselves. We're greatly understaffed for both nurses, clinical officers, and doctors, but the ministry has had difficulty even hiring new graduates because they don't have the funding. Then a lot of the population, over 70%, lives in rural areas, and there's not adequate coverage in the rural areas in terms of health facilities. Okay, I mentioned the Essential Health Package, which is the government wants a set of basic health services, both preventative and curative, available to the whole population at no cost to the population. There are other people who have suggested looking into things like a national health insurance or more sharing of the cost burden even by the patients to make this possible. So it's a great policy to want to provide that to everybody, but you have to have the resources to do it and find it in some way. Now, there's been great successes, particularly with AIDS HIV, because the percentage of people on treatment has dramatically increased. The percentage of pregnant women who are HIV positive who get treatment has greatly increased, so that the transmission from infected mother to child either in the womb or after birth has been really decreased. So there is good news as well as the challenges. Well, there's health facilities, there's health manpower, there's educational institutions, and then there's partnerships that the government has. So the Christian Hospital Association of Malawi, or CHAM, of which Nkoma Hospital is a member, provides about 35 to 40% of healthcare in the country, and in the rural areas about 70%. So that's a key partnership. And also the CHAM units provide the majority of nurse training for the country. There are vertical programs that are funded outside but part of the ministry, HIV/AIDS, malaria, TB, and those are important structures that provide, even through CHAM institutions, free treatment to patients. Generally we have to charge something, but for these programs, for HIV, for TB, and for malaria, what we get free through these vertical programs, we pass on free. So those are very important structures to be able to get treatment for these common conditions in Malawi without a cost barrier. Okay, well, of course there's the government, and then there's CHAM. As I mentioned, CHAM provides about 35 to 40% of healthcare. There are also some private facilities, and then there's the informal, traditional healers that also play a significant role, sometimes positive, sometimes not so positive. But we're also trying to work with that sector to make sure that people they see that need to access care for obvious conditions like HIV, malaria, epilepsy are referred to us. Okay, don't do something without finding out what's already being done. Because there's not enough health resources, either manpower, finances, it's a waste for somebody to come in and start something without first knowing what's already there. We've experienced that ourselves sometimes, where people come into our catchment area with certain programs without first finding out what's already being done. So we need to work together in partnership so that we identify areas where there's a real need, rather than people going to an area where things are already being done. So don't go in without knowing what's going on. Don't go where somebody's already doing something. Do find out and partner with people who are already there. Things are improving, but in the past, sometimes there's been difficulty for CHAM units being involved in decision-making discussions with districts in terms of district health plans and things like that. So for governance, the key players need to be involved in decision-making. Preventative health has to be a priority because it's much better to be able to prevent things that we're facing rather than wait till people are sick. For instance, in malaria. It's the most common infectious disease in the country. We have developed some preventative plans, spraying in homes, test and treat to find people who are harboring the parasite but aren't sick, so that you can reduce the reservoir to prevent malaria being spread to vulnerable people. We've already talked about reducing the spread of HIV from mother to unborn child by identifying every woman who's HIV positive and getting them on treatment before they get pregnant. So that's definitely a priority. And then focusing on things like cervical cancer. There's discussion and even some movement to provide treatment for cervical cancer, which is a need, but it's very expensive. But if you can test all women for pre-cancer and eliminate it, then you don't need to worry about treating cancer because it's not going to happen. So that's why our cervical cancer program focuses so much on community education, sensitization and mobilization, identifying pre-cancerous lesions and same-day treatment. Because then you're not going to have to worry about treating cervical cancer because you've stopped it before it even happens. So the priority really needs to be on the preventative nature thing, and then also to focus on the most common diseases that we face.